And welcome back. We are answering your questions about the coronavirus with Cone Health Medical Group family physician, Dr. Zoe Stallings. Remember, if you have questions, you can text them to us. The number is going to stay right here at the bottom of your screen. It is 336-379-5775. Dr. Stallings, the first two questions we've received tonight are both about immunity and how long that lasts after someone gets the coronavirus, test positive for it. Someone asking, is it 3 months? Do I have a safety net? Someone else asking, if I have the antibodies, does that mean I'm immune?
So that's a great question, one that I get all the time. And one of the things that I want to emphasize is that this is still a new virus. We're still learning a lot, and there's still a lot of research, because what we don't know is we don't know what the reinfection rate is like, and we also don't know how long those antibodies will last. So we can make assumptions based on how other viruses behave. So we can say, well, we've seen in SARS and other kinds of respiratory viruses that people have antibodies that last this long. However, we really don't know exactly how long you can remain immune. We don't know if you get reinfected. What we have told patients is that their test could be positive for up to 3 months, even if they have a low viral load. And some people may not show that. So I really don't want anyone to feel so confident that I've been infected and I can't get reinfected. And also, I don't want people to take that chance and expose others, because we just don't know when you're considered immune. That research is still ongoing. And right now there's no consensus statement in the medical community as to what we should do with that antibody result. So we still want to default to wearing your mask, because you could think, I have had coronavirus, I had it in May, so I'm immune now, I don't need to wear my mask. Well, that might not be the case. Your immunity may not protect you, because we don't know how strong, we don't know where you are in terms of your recovery, we don't know what your antibodies are doing and what your immune system is capable of handling with re-exposure. So still wear your mask, and the research is ongoing, but once we understand more, there'll definitely be information for the public.
Yeah, don't let your guard down just yet. So, Dr. Stallings, we are officially in flu season. It is October. A lot of talk right now about getting the flu shot, getting it early, and making sure we don't have a twin-demic of flu and COVID. But someone writes in, how long should I wait after having COVID-19 to get my flu shot? Is there a time period that we need to wait?
So our flu season typically peaks around January. And so if you're currently dealing with the infection and you're having active symptoms, we would suggest to wait until you're afebrile, meaning no more fevers, your symptoms have improved. And then we do want you to consider that when you get that flu vaccine, it's not immediately effective. Your body now has to make antibodies. So we at least want you to be fever-free and that your symptoms are improving. There's no set time limit. As long as you're feeling better and you're on the mend, go ahead and get that flu shot. You can get that without an appointment by going to your local, Cone Health facility, but you need to be a patient at that location unless it's urgent care. Also, the pharmacies have them, but know that if you're having fevers, diarrhea, flu-like symptoms already, you do want to get evaluated first by a healthcare provider who can then order the vaccine for you. But if you're having acute symptoms and you really feel like you have the flu, you need to be seen, because it could also be COVID.
Right. And speaking of those other viruses and illnesses, someone asks, are we seeing an uptick in the flu and strep throat as well, or is it mainly COVID right now?
Like right now, we are not even testing for flu as yet. The seasonal flu does not peak this early, but what has been happening, patients who get sinus infections from the allergies, and remember, we still have a slew of other cold viruses. So we still have the common cold viruses that can cause issues, and so they all behave like coronavirus. But here's the danger with coronavirus. Many people carry it without a single symptom. So for the people who are sick, they stay home. But the people who feel well are usually the dangerous ones, because they go around without their mask on and they get others sick. So we still have common cold viruses. We still have allergic rhinitis, that's a runny nose, cough, and cold. We still have hay fever in the fall, and especially with the beautiful trees in Greensboro, stay on top of your allergy medications and see someone if you feel like you're becoming congested, feverish. Contact your clinic to see if you can make a virtual visit, or call to see if you should get tested.
We've gotten several questions about supplements and vitamins typically used to boost immune systems. Two people writing in asking about the use of vitamin D for an immune system boost. Dr. Stallings, is there any evidence that supports that vitamin D helps, or any other supplements?
Well, I find that vitamin D is one of those, it's gotten a lot of press lately. Vitamin D is very trendy right now, but overall vitamin D helps to keep your immune system robust. It also helps with your bone health. It helps with cognition. That's your ability to focus and learn and think. And so what happens, many people are staying indoors, so they may not be getting sunshine. And we don't necessarily say go outside and lay in the sun for the purpose of absorbing vitamin D, but most people need at least 1,000 units. And that can be found in some of your foods. But if you're someone who has a darker skin pigment, if you are covered up because of religious reasons, or you wear a lot of layers, or you work indoors for 12 to 14 hours a day, you might need a supplement. But another thing that I really want to emphasize, your immune system gets really run down when you are overly tired. A good night's rest does so much for your immune system. So people who are staying up late at night on social media, watching Netflix, not getting their rest, that does a lot of damage to your immune system. So get a good night's rest, drink your fluids. You can take a vitamin D, or a multivitamin will have enough vitamin D. And if you're concerned that you might be low, before you just go taking additional supplements, see your primary care doctor and get some assessment, because more supplements doesn't mean better health. More supplements means your kidneys have to process and filter out what you don't need. So what we want you to do is start by sleeping. Going to bed at night will help your immune system to stay very strong. Balance, eating proper food, making sure that if you do take anything, take just a multivitamin, and then if you need anything else, see a doctor.
All right, Dr. Stallings, stay right there. We have some more questions coming from you, but we are going to take a short break. During that break, continue to text your questions to us, the number 336-379-5775. We'll be right back.